During a BBL, the most important limit to how much fat I can really put in is how much space is there between the muscle and the skin. And so in someone who has a little bit more deflation or loose skin, it might actually allow more popping out and placement of more fat. And in someone with more of a tight skin pocket, that's going to limit the amount of fat that puts in. So in plastic surgery, we're limited by your anatomy at times. And one of the things that we are very concerned about is blood flow. And so if you're pushing in way too much fat and the skin gets tight, what happens is not only does that fat die, you're also risking putting that skin in a dangerous situation where the overlying skin can die. And so those are the limits to how much fat can be put in. Each person is going to be different. And in some cases, people have just these natural tight attachments. They look like little indents in the buttocks. And when I see that, I always tell the patients, it's important to set your expectations. Even with adding fat, I may not be able to pop those areas out, and they may require more of a surgical release of those tethered little ligaments and structures that are holding the fat areas down. And after releasing that, sometimes the skin is able to pop out better, but that's a whole separate procedure. So it's important to just talk to your surgeon, get an evaluation, and set realistic expectations about how much your individual anatomy is going to accommodate a fat transfer.